Morning.
Welcome to the morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
Good morning, Singapore, and welcome to the biggest and best breakfast show in the world. It is a Wednesday, and that's the reason why we have a doctor in the studio. It's Good Morning Doctor Day, and we welcome Dr. Tang Tjun Yip, General Surgeon from Gleneagles Hospital, and today we're talking varicose veins. Good morning, Dr. Tang.
Very good morning. Thank you very much for having me on the show this morning.
I love the way you sound.
Yeah, we're very excited to have you because, I love all the toys that you've brought in. Well, I won't call them toys, but these are your tools of the trade for someone like you. And today we're talking about varicose veins. And earlier, Glenn and I were talking, and I was saying, it's all you need is to just be behind someone going up an escalator and you'll see people with varicose veins on the back of their legs. Some are really, really bad. Some are really, really tiny. But I guess the question is, what exactly are varicose veins and do they only happen on the legs?
Great question. I often get asked this every morning. Varicose veins are basically abnormal dilatation of veins, and they're only found on the legs. So there's a misconception that you can have varicose veins on the arms and hands. Those are normal, actually. They're a normal part of the system. So No such thing as varicose veins on the arms, only found on the legs. Very common problem. Each decade that goes by, you have a 10% risk of having it. So by the age of 70, you have a 70% risk. Did you know that recently Donald Trump, the US president, actually has been diagnosed with a condition called CVI, or chronic venous insufficiency? It's the same as varicose veins, literally. It's the same underlying condition. And you saw his swollen ankles. Well, it's because of varicose veins. So he's 79, obviously a nearly 80% risk of having some degree of vein problems.
So what exactly causes them, though? I mean, is everyone at risk? Because you don't see everyone with varicose veins.
Actually, we're all at risk. Being human, actually, and being two-legged, puts us at greater risk. Did you know four-legged mammals do not have any varicose veins because all their weight is transferred? So gravity is not your friend. Basically, it is a failure of the valves within the veins which keep the blood flowing back from the feet back up to the heart. Once they fail, the blood pools in the legs and then causes all those symptoms and dilatation of the vein. And the symptoms that they can often cause is like swelling, heavy legs, painful legs, skin discoloration, restless legs at night, cramps in the calf. It's a very common problem, often put down to old age, but actually it's a very underdiagnosed problem.
So people who are obese are at risk.
Yes, so someone who's got a sedentary lifestyle, sit in the chair basically, and carry a lot of weight centrally, put a lot of pressure on the legs, and then they are more predisposed of getting vein problems.
So when we're not sitting and standing, we should all be lying down with our legs up? I mean, does that help?
I wish we could actually, but that's not practical. But the two worst positions is, you're right, standing up and sitting down for long periods. So you really shouldn't be sitting for more than half an hour, 40 minutes, unless you get up and about.
Right. But do more women get varicose veins?
Now, that's an often asked question as well. But actually, if you look at the data out there actually is an equal preponderance between male and females. But everyone says it's females because they're the ones who normally present. I think probably they're more discerning than their male counterparts, I think.
Right.
Okay.
Yeah, because as Angel told me this morning, because I haven't seen anyone with varicose veins like on the escalator or whatever. But I mean, she's been seeing quite a few. And I'm like, how did you manage to see the varicose veins? And she said, well, they were wearing shorts and skirts.
Yeah, as long as you can see someone's legs,
and I was like, if I knew I had varicose veins and I wanted to hide my varicose veins, I'd be wearing pants.
Yeah, well,
you don't need to actually see the veins on the surface of the leg. Actually, you just see that brown. You often see people with the brown discoloration of their calves and their ankles. The brown suntan. Obviously, you put down as a suntan.
Yeah.
Or people put it down as diabetes, because diabetes is also a very common problem in this part of the world. Actually, that is because of vein problems. Actually, because the blood is very static in the skin and the leg, irritates the skin, and that brown pigmentation is actually old blood, very static in the skin. skin. Yeah, it's the same problem actually.
it darkens
so you don't
the skin.
actually have to see dilated veins. It could all be hiding just underneath the skin surface.
Okay, later I'll let you see my legs, doctor. Tell me whether I've got varicose veins. We need to remove them if there are any. Anyway, let's continue to talk to Dr. Tang on the Big Show TV. Up next, Charlie XCX. This is Apple on Kiss 92.
Well, since you spoke about removing, I think we might as well jump straight into the what you guys do to remove or heal varicose veins.
Right, and why do we have to remove them? How? What kind of risks do these varicose veins pose?
Do you want to just say who are at risk of varicose veins first of all?
Okay.
And why do patients present? And what are the indications of actually doing it?
Okay.
And then we can go into the techniques.
Sure.
Yeah.
I think this camera might be easier.
Is it easier? Is it easier for me to put stuff in, basically?
Yes, and it
Yeah,
shows
that's better.
So you can put it on a big screen.
That's much better. You know, my mom told me a story. We had a neighbor once when I was growing up, and she had such bad varicose veins. In the middle of the night, she scratched it, and she bled to death.
Oh.
Yeah, you can bleed very
She
badly.
bled to death.
Yeah.
Oh my god.
They found her dead the next morning.
That's a very unusual presentation, but I have heard of that as well. There's been documented cases for that because the blood is under very high pressure, and if you don't know what to do to stop it, you can actually bleed a lot, and it's very frightening actually. But we don't want to let it get to that stage. That's why
Right.
we're trying to educate people, because people often know about their knees, osteoarthritis, hip arthritis. Actually, this is just wear and tear of the valves in the vein. It's the same kind of conditions, wear and tear basically.
Can I take this out?
Yeah,
It might be-
yeah, whichever is easier. That's for the
Okay,
patient.
So
Yeah.
we've got that on the camera.
Yeah. Can you see that?
show us? Yeah.
Fantastic.
Right.
Yeah.
There you go. So tell us what we're looking at.
So, are we on? We're
Yeah,
on.
we're on.
Yeah.
We're
You
on.
can still speak into your mic, Angel.
Oh, good.
Oh.
Okay.
As in, like, turn it.
So, what we're looking at here is this is the venous system. So there are two systems basically that go up the leg. This returns blood from the foot back up to the heart from the foot. So there's a deep system, which is the dark blue vein, which takes about 90% blood up from the foot back up to the heart. That is responsible for aeroplane flight syndrome.
DVT?
DVT, absolutely. Deep vein thrombosis. That's what gets blocked, and you get a swollen leg, and that needs to be treated with blood thinners. But that's not this same condition. The condition that with varicose veins, or otherwise known as CVI, is the vein just underneath the surface of the leg on the inside of the calf and inside of the thigh, and also at the back of the leg. And this is what we call the GSV, the great saphenous vein, and the small saphenous vein. And those are the ones that we deal with day in, day out for varicose veins. And once you dealt with that vein problem, your veins will disappear.
Okay.
Straightforward.
So what exactly goes into removing, or I don't know. I don't even know the proper term for it. Do you remove the vein, or what do you do with the vein?
Yeah. So in the olden days, when I was training in Cambridge in the UK 20, 30 years, it must be 25 years ago now, we used to do big open operations, cut in the groin, strip the vein out. That's called stripping of the vein. It's very painful, causes a lot of bruising. It is no longer the gold standard of treatment for varicose veins. Everything now is done as a keyhole procedure. Everything is done under day case procedure. At Gleneagles Hospital, where I have a big vein set up for my day case surgery, we do everything under local anesthetic and sedation. It means you do not need a general anesthetic. You do not need to be put fully to sleep. You can breathe yourself. You can go home the same day. You can walk the same day. And in fact, you can probably go back to normality within the next 24, 40 hours. The quickest I've had is a hawker who's gone home the same day, 2 hours after surgery, went back to his store and started serving his meals, basically.
Wow.
So someone
it's
like that would
That's
be at high
amazing.
risk because he's standing a lot, right?
Absolutely. I have a lot of hawkers. Basically, it's a professional-based problem. So hawkers, people who like architects in the F&B industry, standing up all day. In fact, bankers sitting in a chair all day in front of their screens. HR, very high preponderance of vein problems. And it's a gradual problem. It hasn't happened immediately. It's happened basically over a number of years. And the other one, interesting group since I've been in private practice at Gleneagles Hospital, is that I've got a lot of spinners under my name.
Oh.
High intensity trainers basically, and for some reason they seem to get vein problems. Normally in females, I've got about 8 of them, 8 young females basically having vein problems after spinning. I cannot put it together, and there's no real association, but there must be a problem there.
Yeah, there must be a problem spinning.
Yeah.
Because spinning, people were having problems with their pee in the past, and now it's
rhabdo
like
as well. Remember?
Isn't that a pee thing?
Yeah, is it?
No.
It is a pee thing. Yeah, it's a pee thing. He's absolutely
yeah,
right.
you know it's a pee thing. Yeah.
You get brown pee basically.
Oh
yeah,
my
that's right.
gosh.
Yeah,
Oh.
and now this.
Yeah.
So
But-
maybe there is something about spinning. Just be careful.
So it's
Absolutely.
not just about standing. It's as long as the blood is flowing down that way. You could be running. Could you?
Actually, running makes things better because
does
what
it?
you're
Okay.
doing is you're contracting the calf muscles and you're pushing a whole load of blood back from your calf back into the central system. So actually, running is actually good for veins. Walking in the right way is good for veins. Once you are much more static, standing, sitting, that's where the problems happen because the blood becomes very static in the skin and causes the symptoms. In fact, symptoms are actually worse at night when the blood is so static, and it can cause cramps in the foot and in the calf at night time. It can
Okay.
keep people awake.
We're going for a traffic update.
Like shooting stars. I could really use a wish right now. A wish right now.
Kiss 92 traffic.
Okay, taking a look at the situation on the roads. On Dunyan Road towards the city before Newton Road, a vehicle has broken down. Avoid lane 2. Other than that, it's heavy traffic all over the place. And remember, Tanjong Katong Road south towards Bedok and Mountbatten is closed. If you have anything else, 8855
Welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Tang Tjun Yip, General Surgeon from Gleneagles Hospital. And you know what? If you have varicose veins, you need to see Dr. Tang as quickly as possible because he'll remove your varicose veins just as quickly.
Yeah, and we'll have a look at how the removal is actually done later when we go on the Big Show TV because Dr. Tang has actually brought in these wires and this chart to show us exactly what happens. But we have a couple of questions from our viewers, Dr. Tang. Angie as well as Lavina have the same question. They say, I have leg cramps quite often. Are these due to varicose veins?
That's a great question. Cramps is caused by multiple problems, but one of the main causes is actually vein problems when the blood is very static in the legs. And if you're getting cramps, especially at night time, that's keeping you awake at night, definitely get your legs checked out. And what you need actually is an ultrasound scan. If you're not seeing any of the bulging veins, it doesn't mean you don't have the problem. You need an ultrasound to assess the faulty valves within the veins. And that's the best way to look at it. And actually, it's very treatable. You don't need surgery all the time. We don't do surgery on all veins, but those who are actually affecting your quality of life, affecting your daily living, those are the ones we intervene on. And actually, you can have medication to treat the cramps very nicely, and it's called Daflon. And, it basically squeezes the blood out the legs and actually can improve the cramps a lot. So get a scan.
Okay, I have one question because earlier you were talking about men versus women, but you're seeing a lot of women as well. Does wearing heels and crossing your legs affect the outcome of your veins?
Oh my God, I'm
That's
crossing my
it.
legs now.
Yeah, I know. I'm just like trying to uncross.
So high heels do have problems, and there's an association with vein problems because when you're in high heels, you are unable to contract your calf muscles as well when you walk. So you're actually on a platform at an angle, so you can't contract your calf muscles. So your blood doesn't efficiently get out your leg. So yes, there is a predisposition. And sitting down cross-legged and then uncrossing it, yes, there's also a static issue as well with the blood. So they are associations with vein issues.
Right.
Okay.
What about going for regular foot massages?
Is that a good thing?
Well, theoretically, it's a good thing because you're squeezing the blood out the foot, basically. So yes, but patients with large dilated veins on the surface of their calf we try to ask them to avoid massage because you can bruise the vein much easily, and they do press quite hard. And
Right.
even after surgery, we tend to keep patients away from massage for at least 4 to 6 weeks.
Okay, and we have Benjamin. Just last question before we go on the Big Show TV. What about compression socks? Do they help?
Compression socks do work, and those have formed the bedrock of treatment if you do not want any keyhole surgery. But As I found out over the last 12, 13 years being here in Singapore, patients do not like compression stockings here. It is too hot. You can get it's very sweaty. There is a risk of having eczema as well. And such a busy lifestyle, hectic lifestyle, young people do not want to wear stockings.
Okay.
And it's quite tight.
All right.
Okay.
But they do help.
Based on what we've been talking about so far, you missed this just now on the Big Show TV. We did talk about some of the sports that might be good for you, and running, according to the doctor, is a good thing.
Pilates,
Yoga.
That's good too.
yoga,
Okay.
cycling. These all increase your venous return, which means sending the blood back from the foot back up to the heart. So these are very, very good sports. Aqua aerobics, being in the pool, water itself, it causes a lot of hydro pressure onto the calves. To push the blood up is actually very soothing. So these kind of sports are very good if you have vein problems.
Excellent. Let's continue to talk to Dr. Tang on the Big Show TV. It's 8:20.
Kiss 92 Time Check, brought to you by...
So we have Kelvin as well as Tan, who are on our Facebook page. Kelvin says, I used to have a lot more weight on me and I had some varicose veins, but I lost 50 kilos and I run often. It's been 10 years and the veins are not causing any pain or any discomfort. Should I still get them treated? And then we have Tan, who says, I've had varicose veins for years and it's partly genetic. Should I get it treated? What are the dangers if not?
Great question. So to answer the first question about asymptomatic veins, you're not causing any symptoms. It's not a life-threatening condition. It's a quality of life issue. It's not like cancer. You must have it immediately treated. However, if you're starting to get skin problems around your ankles or in your calves, when it's going brown or more discolored, then that's an indication to get it treated. But just having veins themselves without any symptoms, leave it alone.
Okay.
And in answer to the second question
Had
regarding
varicose veins for
being
years.
genetic,
Yeah.
I wouldn't say the word genetic is the right word. I think there is a family predisposition, definitely. It's never been proven on what genes they've been on, but definitely there's a predisposition. Just because you've got a predisposition doesn't mean you need to treat it. Don't do an unnecessary procedure if you don't have to.
More a lifestyle thing
It's
than
a
anything
lifestyle
else.
issue,
Okay.
quality of life. Absolutely.
Okay.
Doctor, what are spider veins?
Yeah, great. I get a lot of that is the kind of a lot of the patients come just seeing me for that, and then you find out there's underlying vein problems. So spider veins, these are broken red veins on the surface of the legs. Basically, you can actually get it on the face as well.
I've seen it on the face.
And there's more cosmetic. They do not cause pain. All right, but actually they can belie a higher pressure because these are the end veins basically coming off the faulty veins off the main in the leg. So actually they can be a sign of higher pressure within the venous system, and generally it's a cosmetic issue. And at the vascular endovascular clinic we have now the up-to-date lasers from the US called the Candela V-beam lasers, whereby we can just zap those away in the outpatient setting without any problems, and you don't need any needles. In the past we used to do injections called sclerotherapy, and we tend to avoid that now, and everything is done much more keyhole, no less invasive, much better for the patient.
Okay.
Amazing.
Okay, incredible.
You know what? I want to ask a question for all my fellow gym rats. You know, we love heading to the gym, weightlifting, and sometimes we can lift quite heavy. And is that bad? Because sometimes we can see our veins popping after a workout.
Those popping veins on the arms, they're not varicose veins. They're just basically your muscles are requiring more blood, and therefore more blood requires more blood to be removed out of the arms, basically. Okay. So they become more prominent. So that is the part of the weightlifting process. But actually putting more pressure on your legs with weightlifting is actually not good for vein problems in the legs. Ooh. But for the arms, that's not an issue at all.
Okay, so squats, leg presses.
Very good. Actually, squats are very good, actually.
They're good? Okay.
Actually, it's one of the best maneuvers where you can push the blood out of the leg. But putting weight onto the legs with heavy resistance weights, that can put a bit more pressure. And I tend to ask patients after their keyhole surgery to avoid that for about 4 weeks.
So just using your own body weight, like
Absolutely.
in Pilates and all that. Okay.
Okay, which is why I'm thinking, because I mentioned squats and I mentioned leg presses. So if we're on the leg press machine and it's a 45-degree leg press machine, the weight is coming down on you.
more.
That's different from squats.
Absolutely, because squats actually, what you're doing is when you're bending down and you're contracting your calf muscles and even your back of your hamstrings as well, you're pushing the blood out of the venous pumps that are sitting in the muscle.
Right.
Whereas you're pushing against resistance when you're using weights going up and down. Actually, that puts more pressure on your legs. In fact, those bench presses, when you're pushing against it, actually it's not too bad because you're sitting down and you're pushing against it. That's okay. But we tend to, even after surgery, we tend to just avoid that. We don't want any inflammation. We reduce the inflammation, the inflammatory effect after any keyhole surgery. We tend to ask patients to just shy away from that, rather than go running, just walking. Keep it easy after surgery.
Okay, so I guess that kind of answers Aloysius's question about how we can prevent varicose veins. Daily exercise is good enough, or anything else in terms of, say, food or consumption of any sort of stuff?
I get this often asked in clinic actually by all my vein patients. And then, food-wise, try and increase your amount of less fried foods. Avoid smoking. Smoking is very bad for a lot of things, but it's actually very bad for the valves inside the veins. More cherries, berries, strawberries, blueberries. They have a lot of high flavonoids. Flavonoids are basically very good. They're vasoactive substances and allow the vein to contract better to push the blood out the leg. So more
Purple
of that.
and red fruit.
Absolutely. Yeah.
Okay,
Awesome.
nice.
Okay, so how can people get in touch with you if they want to?
They need a vein or two removed.
I don't do a procedure if you don't need to do it. But if you're worried and you're worried about your veins, come and see me at Gleneagles Hospital. I'm based down on level 8 at 0808, and I'm very happy to see you. And we can go through whether you need to do any procedure. But before you do anything, normally you will need an ultrasound scan to have a look and see where the vein problems start.
Okay, can we quickly show people how you go through with that little gun that you showed us earlier? So
Okay.
we're
So
holding it up.
The way we do thanks very much for holding it. I hope
No
it's not too
worries.
heavy.
No.
Way we do veins now is all keyhole. Everything is done through a very tiny, minute incision, normally at the ankle or just below the knee. And it's about 2 millimeters. Everything is done under sedation, a bit of local. And we have all these new devices now. The gold standard is actually a thermal ablation technique. So you see all these little wires, they're actually special catheters. So these two, as you can see, are what we call, one is a radio frequency catheter, and this is the new near laser actually in Singapore. First time in Europe being used in Southeast Asia. It's even more keyholes, so it's very, very small. And what we do is we pass up the catheter all the way up, and we under ultrasound guidance, and we seal the vein backwards as it comes out.
You seal it with?
The heat.
Glue.
Basically. No, hang a minute. No, we'll go to the glue in a minute. We'll come to the glue in a minute.
Okay.
And basically you seal the vein all the way from the groin and come out through that incision. And it's all heat-based, and it just seals that faulty vein on the inside of the thigh.
So this is from behind the knee.
From behind the knee.
Okay.
And now we do combination techniques using glue and laser. And why we use glue, we don't want to cause any nerve injuries. And this is used a lot in the US, where we just put a special amount of glue all the way from the ankle all the way. You can even pass it up all the way up, basically.
All the way to the groin.
And then seal it. And basically, you inject glue under direct vision and you seal that vein. And which device we use depends on the patient's anatomy, patient's preferences, their daily lifestyles. Those are all things important to check before you do anything. And that's the glue we see. And that's basically quite an expensive glue. A couple of $1,000 bottle of glue, basically.
What else is that glue used for in medical terms?
Yeah. So they often seal things like varices, these dilated veins in the stomach, basically, which can bleed.
Okay.
And it's an embolization, what we call an embolization agent, where we seal faulty venous structures to prevent them from bleeding.
And just in case you didn't see, this really looks like a glue gun. You know those glue guns you buy for art and craft? It does look like that. So that's connected to the wire where the glue goes in. Yeah.
So we use a combination techniques to get the best possible outcome for our patients. So it's combination therapy. And the best thing is to do a good job first up, because you reduce the risk of recurrence in the long term. And the recurrence rates are very low at 5 years.
Okay, what about things very quickly? I think we have about a minute, 40 seconds. What about things like travel, on the plane? You were speaking about deep vein thrombosis earlier. How do we prevent that from happening?
Good question. So anything long haul flights, and I gauge that more than 5 hours, those patients who have vein issues are more predisposed to getting problems such as thrombosis, there is a higher risk of deep vein thrombosis in these patients. These patients should be wearing compression stockings, and don't buy them over the counter. Get your legs measured and fitted properly. And you only need to wear stockings to the knee. Good hydration, avoiding too much alcohol, movement around the plane. Even if you're sitting in business class, you should move. And those are the kind of things to reduce the risk of having a vein problems afterwards.
Okay.
I keep on telling you, don't drink so much.
Oh, wow. Hello, pot. My name is Kettle. But it's interesting that you said even in business or even in first, I would think if you're not, you just need to get up and
You
move,
need to move.
whether you're
you
lying
need to
down.
get up every
sitting.
half an hour and stretch your legs.
Okay.
Very important.
All right.
So I'm saying if you want to be like totally healthy, you won't be able to do anything. You can't drink, you can't smoke.
You can't do anything.
But that's the...
Smoking's very bad. Smoking's very bad.
Yeah, if there's one thing you can choose drinking. Which is true. No,
A glass of red wine. My father-in-law often asks me,
Yeah.
is a glass of red wine fine a day? Absolutely. Very
Okay.
Good. Very good.
Well, there you
Just
go.
a glass,
A glass,
that-
Glenn, not a bottle, yeah? A glass. Let's go to traffic.
Okay.
Kiss 92 traffic.
On the CTE towards the AYE, a broken down vehicle has been spotted before Brattle Road. Also on the AYE towards Tuas, another vehicle having trouble before Lower Delta Road. If you spot anything else, you can WhatsApp us 8855
Welcome back to The Big Show and The Big Show TV. One last time, we're speaking to Dr. Tang Tjun Yip. It's been a very, very, very interesting session. We've been talking about varicose veins. Dr. Tang is a general surgeon from Gleneagles Hospital, and we really highly recommend that you go look for Dr. Tang if you've always been wondering about
Varicose
your
veins.
varicose veins, or perhaps maybe you've suspected that you have an issue.
Yeah.
Okay. Before we let you go, Dr. Tang, one last question for the people who were not watching us earlier on, and when we asked you this question, what lifestyle changes can be made to ensure proper blood flow in our legs?
So avoid smoking, number one. Bad for your valves and your veins. In fact, bad for clogging up any arteries in the legs, but bad generally for your vascular condition. A good amount of exercise. How do I gauge that? Probably you should do at least, some walking every day, 20 minutes, moving around. Get your circulation running. Try and avoid too much weight gain because that puts a lot of pressure on your legs. Moisturize your legs, actually. Prevent complication from having any vein problems, because if you have a vein problem, it makes your skin very dry and crack and can cause infection called cellulitis. So moisturizing your skin with any moisturizer is very good.
I'm going to do that starting today.
And you're out in the sun a lot.
That's true.
Yeah.
And a good diet, basically. Healthy diet, bit of oily salmon, berries, cherries, blueberries, as we alluded to earlier. That helps your flavonoid counts in your blood. These are all just preventative measures to avoid having any surgery.
Perfect.
Thank you.
Thank you very
so
much,
much,
Doctor.
Dr. Tang, for joining us today and, being so clear and bringing in the models and all that. I think our viewers really, really appreciate that. Thank you so much.
Thank you very much for having me.
We've been speaking to Dr. Tang Tjun Yip, General Surgeon from Gleneagles Hospital.
For more insights or to replay today's segment, the full episode is now available.